We are. Okay. Well, today is day umpteenth of the COVID-19 crisis. And every day something new and different. And we should introduce ourselves. I'm Greg Plotnikoff, a physician with Minnesota Personalized Medicine in Minneapolis, Minnesota.
And I'm Linda Bluestein, a physician in Wausau, Wisconsin, with Wisconsin Integrative Pain Specialists and also Hypermobility MD.
Yes. Both of us and our colleagues are facing a lot of questions that probably you have. They're frequently asked questions. Our mission today is to be able to answer some and to be able to kind of give people a sense of confidence moving forward that we're doing everything we can individually and collectively to minimize the impact of this crisis, for lack of a better term.
I think that it's so helpful to do things like this in order to empower patients that there are things that they can do. It's not all out of their control. So we have gotten some really, some important questions that I think would be helpful for us to address, and that way people can hopefully help with the fear component, which we know is also really significant and really important.
Yes, and here in early April, there's still lots of time before the peaks here in the Midwest. So there's a lot of things that people can be doing, and no need to say, oh, I give up and I throw up my hands and whatever will be, will be. No, there's some things we can do now. And that's why it's really important to know about. And one of the reasons you may know why that's true is the fact that, wow, internationally, some people do great and some people do not. In fact, the vast majority of people do great and some do not. People say, well, why is that? Okay, outside of the urgencies, what's really important? From your perspective, what's really important for people to know?
The fear component, that when we go into that place of fear, that actually actually suppresses our immune system. And so one of the most powerful things that we can do no matter where we are, no matter who we are, as much as we can work with what's happening up here, right? And it's something that can be quite challenging, but gets better with practice. So that's where doing this now, I think, is so important.
It doesn't need to be perfect. It's practice. It's a discipline. And many of these are things that can be guided. Insight Timer is a nice app. There are multiple apps. Recently, I've really liked 10%.com and a lot of materials there. A lot of things on YouTube. In fact, we're all kind of on a bit of a sabbatical. It's not like we don't have to get to parties, we don't have to get to things right now. We're all given more time, and maybe this is actually a good time to kind of actually then incorporate things. There's less time demands on us now.
Well, it's interesting that you say that, because it's all in how you manage that time, right? If you end up watching the news, we could consume ourselves with the news 24/7 and then not have free time. But you're right. A lot of us can have some time freed up because of certain things that we were going to be doing that we're no longer doing. That it starts there with those choices that we make.
Yes, and one of the choices might be no media.
Yeah.
No media right before bed. Oh my goodness.
Oh yes, definitely.
Yeah. And those first 3 minutes waking up in the morning, that twilight zone between sleep and awake, Pilar Gerasimo describes this as kind of a unique moment in our day. And she describes about the importance of taking 3 minutes out to just focus on self, doing something that is meaningful, lighting a candle or whatever the case may be. But she says it's that moment that our brains are in theta wave states. And it's a highly suggestible state. And that can be really good when setting intentions for the day. Or it can be really detrimental if the first thing that comes to our mind is the latest on the news or checking one's emails or whatever the case may be, maybe not such a good thing at one's most susceptible time of the day. This is a unique moment. It's 3 minutes different from any other 3 minutes of the day. And sleep is really important. Gosh, it's really hard to sleep well if we've done media right before going to bed. We think about what are we introducing to our subconscious before going to bed? Well, how about something positive, constructive, rather than a focus on things which engender fear and reactivity.
Right. Yeah.
Of course, good quality sleep is actually fundamental to everything else.
Mm-hmm.
It's kind of, those who are saying, oh, I only have time for 4 hours of sleep at night. Well, is that still true? But people are also wondering, what can they do diet-wise or exercise-wise or supplement-wise? Do you have particularly one supplement or a couple supplements that really stand out for you?
Boy, yeah, I have quite a few, as you know. I guess a couple that I'm a big fan of right now. Number one, palmitola ethanolamide, which a lot of my patients would, oh, you've got your bottle right there. I should have brought my bottle in here too.
Yeah, same.
Yeah. So I take the liposomal, the liquid form of that. I've been on it for quite a while myself, but I vary the dose. You know, if I in the past have been doing well, I would take less, but now I've increased the dose, and I make sure that I have it on hand in the event that I would get sick. I would, increase the dose of that further. So we know that acts on endocannabinoid receptors, right? And that is very important for the immune system. And so this is something that also stabilizes mast cells, right?
Yes.
And it's been shown to have some antiviral activity and help with inflammation. And so for our population of patients that we treat, we often discuss this supplement already anyway with them. It generally is very safe, very well tolerated. And, in terms of like interactions with other drugs and things like that, usually, not something that really is a problem. So that's one of my favorites.
Oh, I like it a lot too. For pain, for some types of pain, people found fabulous. My 93-year-old father with severe spinal stenosis and a variety of other things, he swears by it. It's kind of like, this is awesome. But people might not be aware that there are actually 6 randomized controlled trials that of PEA for prevention of influenza, and appears to have some kind of important effect. So I thought, okay, actually it's no downside, especially if people have mast cell, if they have certain types of pain, it's worth trying. I'd much rather people be on PEA than Advil or Tylenol.
Right.
For about $30 a month or so, been kind of like underappreciated, under-recognized. There are several PEAs out there in terms of palmitoyl ethanolamide, multiple brands. So Linda, you mentioned about liposomal. I just showed a product that comes in capsules. What you don't want is PEA, which is phenylethylamine, which is an amphetamine-like agent.
That's an important distinction.
And it's interesting you mentioned about the liposomal form. And does that also have like luteolin in it?
The one that I take does not have luteolin in it, but I do have I have a couple of different brands actually. One of the brands that I have has luteolin in it, and the other brand is the one that has the liposomal. And so what I had been doing before all of this was using the liposomal when I'm home, because it's refrigerated, and then taking the capsules when I'm out and about. Well, now I'm home more, so I can take the liposomal more often. So it doesn't taste the best, but it doesn't taste terrible. What I usually do is I actually add in a little bit of my liposomal vitamin C. And so I'll make myself a little cocktail with my liquid vitamin D and my liposomal C and my PEA, and Okay.
So. You mix it with water, so it's kind of less gooey.
I do a little bit of a water chaser.
Yeah, the thing is, it's been a nice expression that translates from Japanese as the worse it tastes, the better it is.
Oh,
And in terms of things, and I think that a lot of the liposomal forms it's a texture and other things that have been interesting. But the secret is, at least for my liposomal phosphatidylcholine, it's been mixed with water, and it's just and I'm getting closer to having family members be able to do it. But yeah, so PEA has been a really kind of a nice one. You're doing a lot of vitamin D as well.
yes. So I routinely, check vitamin D levels on my patients. There's the baseline dose in order to keep you in that, do you aim for a serum level usually in the range of, for vitamin D, 25, hydroxy of like between 50 and 80, or what level do you like to see?
I've been following more of the 40 to 60.
Okay.
Unless people have certain vitamin D receptor variations, where I would go higher. This is one of those times where the higher the level isn't necessarily better. So we've heard people recommend levels of 100 or more, and there really isn't any evidence to support that at this time. These are rough estimates now, and gosh, of course, no one's going to go to a lab and get theirs measured now.
So what are you advising to people who don't know what their baseline level is?
So for kids, I say in general, 1,000 international units for every 25, 30 pounds. Up to, once people reach teens, and probably, saying about 3,000 a day or more. Most adults, depending on weight though, about 5,000 a day. Now, if one is an adult and weighs like 100 to 110 pounds, 3,000 or 4,000 a day is still a really good dose. And
everyone, of course, now wants to stay out of intensive care, right? And there's data about low vitamin D being a risk factor for intensive care admission. There's statistics on that as well.
Yeah, the big New England Journal study published last year of 1,300 plus people admitted to intensive care units, 79% were severely low. That's the biggest concern. Okay, we might get COVID-19, we might get the virus, the coronavirus, but we might not end up with the disease per se. And so vitamin D is a very important thing. And big point for, at least here in North America, is that for people kind of like north of Chicago, and the equivalent is, one can really only make vitamin D between tax day, April 15th, and Labor Day, early September. Now, if the laws allow us to leave our homes during this time of quarantine,
right.
That would be one thing. We cannot make vitamin D behind glass. We cannot make vitamin D wearing clothing. So it has to be unexposed skin. If you're wearing sunblock, SPF 8 will block vitamin D production by 95%. So actually supplementation makes good sense. You hear about 8 physicians who died in the United Kingdom treating people with the coronavirus. They died of COVID-19. But all 8 were immigrants from equatorial areas. So they had gone from south to north, and London, 62 degrees north. So it's about 2/3 of the way to the North Pole. Very different. And so the darker one's, the key point is the darker one's skin, the more sun one needs to make the same amount of vitamin D.
When people are looking for supplements and looking for vitamin D supplements, you want vitamin D3, right? And eating it with or taking it with some fat helps with absorption, right? And then what about K2? Could you comment on that?
Oh, I can't say enough good things about K2. So vitamin K, like vitamin D, was misnamed. Vitamin D should have been named a hormone. Vitamin K should have been vitamin F, but it was named K for coagulation. And the German word for coagulation starts with K. And so all the focus has been on blood clotting. Nothing about the 10 other functions that vitamin K does for bones and brain and blood vessels and heart and anti-inflammatory and anti-cancer activities. Under normal circumstances, our gut bacteria can make some vitamin K for us. We get vitamin K1 in diet, green leafy vegetables, yay. But we have to transform that into vitamin K2, and that doesn't always work so well for people. So we depend on gut bacteria to make vitamin K2 for us. But the pathway they use to do that is blocked by Roundup, by glyphosate. There's a lot of glyphosate flying around in the air. There's a lot of exposure we have. Even if we are on a total organic diet, we can still have a lot of Roundup in our system. So for that reason, if one is not on blood thinners that require, that go by names like Coumadin or warfarin, which are anti-vitamin K drugs, then it makes good sense to be on vitamin K as well. And a lot of the products now have them combined, and so it makes it easy to do. Well, vitamin A is something that is surprising. No one pays attention to vitamin A. And no one in this country measures vitamin A. It's understood to be kind of an issue in developing countries. But in our little first world clinic here in Minneapolis, we have found more than 40 people with significant vitamin A deficiencies in the past year. And when we started testing because of genomic profiling suggested that people would be low in vitamin A. And so we started measuring it, and lo and behold, people were, despite good diets. Mm. And a good diet right now would be a lot of orange and yellow vegetables, yams and carrots and mangoes and the like. But they have pre-vitamin A. And that's what kind of surprised us. Pre-vitamin A is a big, long chain, and to be activated, it needs to be chopped in half. And that capacity to chop it in half varies between people. So some people might not be making vitamin A, but you can't go wrong eating a lot of foods containing vitamin A.
So that's really interesting, because there might be some people that are getting some vitamin A in a multivitamin, right? There's occasionally. Are there certain doses that you're recommending to people?
Well, actually, that's really important, because just like too little can be a problem, too much can be a problem, especially in women of childbearing age. So if there's any risk of becoming pregnant, one has to be really careful about not getting too much. And that's why I say pre-vitamin A, more carrots, more sweet potatoes,
sure.
Not taking a supplement. However, if one would become ill, 5 days of additional activated vitamin A is going to be safe in terms of not getting too much vitamin A. And 10,000 international units, I think. And for example, here's an one brand activated vitamin A. Now, I'm not promoting commercial products or purposes, but just saying, right. When you look at vitamin A and you look at the label, some of them will be palmitates, which are activated. Some of them will be carotenoids, like beta-carotene, which are pre-vitamin A. So carotenoid, big, long, pre-vitamin A, chopped in half, active. These are the retinoids. Sometimes will be used. Some kind of retin and palmitate will be some connected with that.
What about other supplements that you recommend, and other things that you recommend changing actually once a person does start to show symptoms?
Well, I pulled out some things here which are kind of nice. I actually, a lot of people are worried about, can I boost my immune system, and can I boost it safely? And I'm actually a big proponent of medicinal mushrooms, like Five Defenders is a very good mushroom. My community is labeled comprehensive immune support. It's capsules, or I keep a spray bottle with me, and literally spray in the morning for my mushrooms. But medicinal mushrooms make good sense as kind of part of an overall protection, good immune status. If one is kind of like ill and having to like seek out like urgent care, emergency care, then that changes everything. And I would say back off with that.
Okay, so the mushrooms are for prevention. Those are not for you. Would you actually stop them then if you started to get sick?
Yeah. Well, if one started to get really sick,
Okay.
that changes everything.
Okay, that's an important distinction.
But it also changes something about, we talk about PEA being important for pain for a lot of people. And a lot of people said, oh, what is general guidance right now for non-steroidals like ibuprofen, general guidance for acetaminophen? Are you concerned about people using Tylenol and acetaminophen at all?
Well, I'm concerned about acetaminophen because of the impact that it has on glutathione levels. Yeah. And we know that glutathione is so important for pulmonary function, and it's the most powerful antioxidant in the body, right? So I am concerned, and especially if people are using it to treat, kind of a lower grade fever, where I feel like, if you have a really high fever, then that's a different story. But what do you think about that, and about, when you should ride out a fever and when you should treat it?
Well, I have to answer with a story. This is wild, but for many years for 6 years, I was a professor at Keio Medical School in Tokyo. And on rounds one day, you're seeing a patient with fever, and I'm just kind of like, in my best Japanese, I tried asking him, why aren't you giving acetaminophen? And people just kind of stared at me. And I said, oh, I must be mispronouncing this right. And I said, I tried saying it a different way, and people just kind of stared at me. And finally, I'm just kind of, oh, I don't understand why you're not treating the fever. And just kind of, Greg-san, it's kind of like, a fever is the body's natural healing response. Why do you want to suppress it? It was reflex, just kind of, oh, my temperature is above 100. I better take some Tylenol. In fact, actually, it's your body's attempt to kind of take care of things. And so I'm just tying one arm behind his back. So no, I actually, so I think, minimizing fever suppression. So in Japan, what they did is they would wrap the body to keep it warm and cool the forehead. But I think all of us were trained to think, oh, a fever of 103 is dangerous. What's dangerous to the virus is there to get rid of the virus. The virus can't survive in that kind of setting.
Yeah.
But your medical training, was it like mine, where you're just told to reflexively write orders, temperature greater than 100.5, administer Tylenol?
Yep, absolutely. It was part of routine, standard orders. Yeah, definitely.
Yeah. No one in this hospital will have a fever, thank you very much.
Right, exactly. Whether they need one or not.
Yes.
So yes, I definitely, I know that we get that question a lot. And the question about the non-steroidals is super important as well. Ibuprofen, naproxen. People are, of course, on prescription things like diclofenac or meloxicam, Celebrex, those kind of Celecoxib.
Well, the FDA has come up with statements saying no need to avoid non-steroidals in COVID-19 time. And they gave a definitive kind of authoritative statement. My counterbalance to that is I'm concerned about its effect in people who are in the hospital with COVID-19, that actually administering non-steroidals actually can serve to actually imbalance the immune system, actually drive more inflammation. And until that is proven to be false, there's enough evidence, I believe, to support avoiding these, if at all possible. If someone does require round-the-clock Tylenol or frequent Tylenol, sometimes I would recommend N-acetylcysteine to be taken at the same time.
Sure.
but people say, well, how much of a dose? And that varies. And how do you like differentiating between N-acetylcysteine, NAC, NAC, and liposomal glutathione?
Both of those can help with pulmonary function, as you had mentioned earlier, and clearance of mucus out of the lungs, right? So
Yeah. Yes.
I think that whether someone is on Tylenol or not, or acetaminophen or not, that those are things that definitely can be helpful. So I've been recommending actually N-acetylcysteine for my patients, even ones that had not been on it previously, especially for my patients that have emphysema, asthma, other respiratory signs potentially of mast cell activation syndrome, those kinds of things. So a point about the acetaminophen too in some of these other products, it often is abbreviated as APAP, right?
No, yes.
So because it's such a long word and it's hard to fit all that on the label. So if someone doesn't know that, then, and then it'll say 5/325. So they won't necessarily know. So.
Yes. In fact, APAP is acetaminophen. 325 is acetaminophen. Yeah.
Right.
Wow, but so N-acetylcysteine can also be really useful sometimes with mast cell in general. There's a lot of reason to believe there's a lot of oxidative stress or other things, and it just made me think about that. I pulled out another bottle here, quercetin. I imagine you use a lot of quercetin in your practice.
Love it.
What do you most like about quercetin?
Oh gosh, I really feel like my patients that have mast cell activation type symptoms, so allergic type symptoms, rashes, hives, flushing, itching, I find that often will help with those kind of symptoms. And it's a flavonoid, right? So it's something that's generally safe, well tolerated. And I started on that myself. I have quite the slew of supplements that I take, and I prescribe that for a lot of my patients.
Well, I've been surprised. Sometimes people need to go fairly high dosing on it.
Right.
I start people at 500 twice a day, but people say, "Oh, I didn't do anything." But when we up it to 1,000 twice a day or 1,500 twice a day, sometimes that has been really helpful. And
are there other things that you're recommending to people that we haven't talked about?
Well, you're very kind, but I respond to that. But the other product we mentioned earlier was luteolin, and that also is a very good mast cell modulating agent, and it has a variety of activities which are really interesting. It's a natural product, but it's very poorly absorbed. And I know that one of our members of our group, Dr. Thea Harides, kind of like the master of mast cells at Tufts Medical School, and author of the big New England Journal review article recently. He's working on trying to get a better absorbed formula of luteolin, and so we might be seeing something come out in the future that I think would be really good for a lot of things, since mast cells are so important for people with endometriosis and migraines and so many common challenges. So what other things that are important for people? And I think this is a time to make sure that one has good zinc, good vitamin C, good selenium intake, and that there may be roles actually increasing one's dosing now. And part of it is because the new understanding of what's going on with hospitalized COVID-19 patients is that vitamin C may actually serve a very protective role in the body's capacity to carry oxygen, which seems to be the big issue. Right. It's not ventilatory failure, it's oxygenation failure.
What are you recommending in terms of oral dosing?
Well, with the two forms, this is a capsule versus liposomal. Again, it's really interesting. But vitamin C is also, there's only so much it can get into the bloodstream. A couple thousand international units a day is, from my opinion, so therefore subject to bias and subject to being completely wrong. But a couple thousand a day is very reasonable at this time. Increasing if one becomes ill. Again, kind of the idea of a 3 to 5 day significant increase in intake. The challenge is that vitamin C, my perspective, or my people report kind of loosened bowel movements and other things, and that can vary person to person. Like, so have you seen a difference between the capsules versus liposomal vitamin C in terms of their capacity to create diarrhea or tolerance, intolerance in people?
Right. The liposomal one that I recommend that is sodium ascorbate, I feel like is generally pretty well tolerated even at the higher doses. But yet, I don't know about you, but this is something I commonly recommend for building, helping not be the rate limiting factor in building connective tissue and also stabilizing mast cells. Well, now we know that, things have changed, and we're not only concerned about everything that we were concerned about before, but for this population of people, we're trying to make sure that we boost their immune systems as much as we possibly can. So
yeah. So what's a good dose to tell people? What's based on your experience there?
So I'm usually telling people that baseline, like 1,000 a day, which would be either 500 twice a day or 1,000 sustained release, once a day. And then for maintenance type dosing, once they've had high risk exposure, or if they become ill, then, I'm telling people to go up to, like you said, 2,000 a day, 3, 4, 5. I mean, it's a water soluble vitamin, right? So you need to, take it kind of, maybe even hourly in the beginning, but I am a huge fan of vitamin C.
So I see no downside to vitamin C at all. So I think that's when we kind of talked about great safety profile, creating boundaries around media, focusing on being awareness of our own stress, and all these things that allow us to be aware of our own breathing, take us into the moment. No downside for those.
Right. Absolutely.
No downside with good understanding of vitamin D, dietary source of vitamin A, dietary source of vitamin C and vitamin C supplements. Zinc. Well, maybe we should talk about zinc, actually. Zinc and selenium.
Sure.
Some people are recommending that everyone should be on every adult should be on an additional 200 micrograms of selenium a day during this time. Do you believe that that's warranted, or what's your approach to selenium?
I think that's probably, not unrealistic. I think, it's hard because some people, they get overwhelmed with the number of different recommendations and the different things. And I think it's important to consider what is in any other multi that you might be taking. For example, maybe not a multi, but if you're taking a supplement for your prostate health, for example, there might be selenium in that, right? So so you might already be getting, so probably looking at what you're already taking is a good idea. You're going to show me another thing, aren't you?
Well, actually, that I'm pulling up a bottle here, a multivitamin here. I'm going to show my age here.
That's okay. I've got to do this too.
And so, yes. So here is a typical dose in this multivitamin has 200 micrograms in it. That's already far above the RDA. And so that was been part of my concern is people were saying, oh yeah, everyone should be on yet another capsule. I thought, well, maybe not, but you might already be doing quite well in your multivitamin. But zinc, speaking about nuts and seeds and stuff are good sources of zinc. How often do you think zinc needs to be supplemented?
I usually recommend twice a day with meals. I don't know if you're recommending more frequently than that. I think, again, it depends on if you're already taking other supplements, whether they be a multivitamin or maybe you might be taking some kind of immune supplement. Definitely look to see how much is in there because you might already be getting some zinc, some supplemental zinc. So look at that first before you decide whether or not to take, a separate zinc supplement, for example. But I know that the dosing is going to vary, right, depending on if you're doing this for prevention or for treatment. So what are you recommending?
Well, the RDA is about 20 milligrams per day. But surprisingly, we see a lot of people with low levels. And so there's a lot of reasons they may be losing zinc. Zinc is so important for immune function and for digestive function and for healing of the gut and for can be related to mood and so many other things that going above the RDA of 20 milligrams a day, in my mind, makes good sense. And during this time, 30 milligrams a day, or in some people I see who have very high copper levels. Mm-hmm. You want to actually have a good copper zinc balance, and sometimes like oral contraceptives or inflammatory states, it kind of goes way out of balance, high copper, low zinc. And those people definitely want to use much higher levels of zinc on. Well, you're right, zinc has its own limitations of absorption, so twice a day makes good sense. What kind of guidance do you give people on kind of dosing guidance for this?
I generally have been recommending more in that like 15 to 30 milligrams per day range. Like 15 milligrams twice a day, kind of on the upper limit for prevention.
Yep, and picolinate is a common form, but there are many other forms. Do you have a particular form that you like?
Boy, the picolinate is the form that that I think is the brand that I recommend more often. What do you use?
Yeah, that's the same one I use too. Okay. So, but zinc has its clues for low zinc can include issues related to taste, low taste, low protein digestion. One can look at the tongue, and we've seen people with tongue aberrations. We have kind of what's geographic tongue, or looks like little islands of stuff on the tongue. Sometimes can be low zinc. People also talk about sometimes if you have little white spots in your nails, that can be a sign of low zinc as well. It's easy to supplement. One doesn't need to go massive doses with it. And when the all clear signal is given, we can all get our levels measured.
Right.
Well, Linda, what a delight to spend this time with you. And,
it's been fun for me.
And thank you. And so if people want to send questions to you, your website again is?
So my website is hypermobilitymd.com. That's the best website to use. And the best email to use is bendybodiespodcast@gmail.com. That's the best email to send questions to. Well, it's been so great to chat with you. Thank you so much for sharing your incredible expertise.
Well, likewise, and I always learn something new, and I appreciate it so much for being a teacher. And I also thanks for the opportunity to kind of talk about this. And questions for Minnesota Personalized Medicine can be sent via the website, mnpersonalizedmedicine.com.
Well, great. Well, I'm so grateful to you for doing this today, and I hope people found this helpful. And we would love to get your comments. So please give us your feedback, because we would like to provide whatever information that you're looking for. We want to make sure that we are helping you to the best of our abilities. So please let us know what you found helpful. Let us know what you did not find helpful, and other further questions that you have. So thank you so much.
Thank you. All right.
Great to chat with you. Okay.